My name is Sam. I'm a musician, I'm a father, a husband, and since 2020, I've been a brain tumour patient. I'm making these films with the Tessa Jowell Foundation to help explain what it's like living with a brain tumour. I'm delighted to have Nicky, the CEO of the Tessa Jowell Brain Cancer Mission, and we're going to speak a little bit more about what's being built up. We've spoken and heard a lot about what's missing at the moment, but I think it's important to talk about what's being built and what the hope is for the future. So, Nicky, talk to me. Talk to me about the mission.
Well, first of all, thank you for having me. And I'm the CEO of the Tessa Jowell Brain Cancer Mission. And the mission is a non-profit organization that exists to improve research, treatment and care for people and children with a brain tumor. We do three things. We improve care and treatment for the patients out there today. Then we also train the workforce, so we train the doctors, nurses and allied health professionals who are delivering care and treatment for these patients. And then the third thing that we focus on is accelerating research and accelerating new treatments towards the patients today.
Brilliant. That's good to hear. Being a patient myself, I think a big side of it, away from the research labs, away from the clinical side of things, is the support for us as a patient, for our families, and how we get through that kind of journey from start to finish. Well, I guess finish, it's an ongoing thing and it's an ongoing process. Yeah. Can you talk to me a little bit more about the mission and how important that is in providing support to patients?
Yeah, absolutely. So it's really at the core of what we do. And one of the main elements of what we deliver is what we call equity of access. So we have this vision that, and it's the case already today in many centers, but what it should be the case is if you get a diagnosis, which is devastating, as you know, what I would like patients and their family to feel is that once you walk through the door of a brain tumor center, you are like, okay, whew, I'm going to be looked after by the best possible team. I'm going to get really good treatment. But beyond treatment, I'm going to learn to live well with my diagnosis, and people will take my symptoms seriously. People will listen to me, and they will connect me with people in, say, rehabilitation who are going to help me to regain my movement or walking or talking. So really to have that sense of like, okay, I do not have to Google and look abroad for treatments. I do not have to double check everything that a professional says or think, should I go to the neighboring center? No, where you are now is where you will get it. So that really, really matters to us. And we work very much with nurses and allied health professionals who are the professionals who spend most time with the patients. And, sometimes you see your surgeon or oncologist only briefly, you discuss your scan and your treatment, but then it's about learning to live and to live well. So that's for us, we feel is one of the most important things that matter.
Brilliant. Because you touched on something there about living well. Yeah. Living well is a really hard thing to do when you are on the journey of a brain tumour journey, and it's hard to find that motivation sometimes. And like you just said, when you come for treatment or you come in for an appointment, you're already right on edge before you're there. Going in there, that experience can have such a massive difference. I've been on the benefit of having that myself. What are you doing at the moment to try and empower these people that are in these positions of being close to patients? What are you guys providing to kind of help that?
Yeah, so many different things. What we know, so one of the things we do in the mission is we collect data every 3 years from all the centers looking after patients, and we look at the care and the treatment they provide. And what we know from the data is that the care you get from your nurses or the care you get from, say, your physios or your occupational therapists, your speech and language therapists, that care from center to center is most variable. So you might get phenomenal nurse care in one center, but it might be organized completely different way in another center. Now, sometimes that's appropriate because, of course, if you're, say, a London centre in a very dense area, you organise your care differently to, say, when you're in rural Scotland and you have a mega area to cover. However, we feel that getting good nurse-led care and rehab care is a non-negotiable. So we try and make that care more equal. So we collect data on how people do it. And then we share that back to the hospitals, and we might say, okay, actually your nurse to patient ratio is some of the best, and how you've organized your nurses is really, really good. However, we see that you almost are not able to give people access to speech and language therapy. Right. And you are behind most other countries. And when they know that, we can help them, or we can help them submit business cases to address that.
So you're kind of like going in there and doing a strategic evaluation of the service being provided.
Exactly. And then in the end, the change is going to come from the allied health professionals and nurses who have to push internally for that. And we call those people local champions.
Right.
So those are your nurses who don't just look after you and do a phenomenal job, but they also go back to the lead of the neuro-oncology team and say, look, I need another nurse, I need to modify this clinic, or I think we can optimize the way we break bad news to people. And if those people are empowered and listened to, we know that correlates with actually better care overall. So sometimes it just starts by supporting the staff to take up that leadership position. So that's one thing, to really develop care locally. The other element that we do is we want to train those nurses and allied health professionals to become good at research. Right. Because why is the care so variable at the moment? That is because there is a lack of standards. So if you look into what's called the NICE guidelines, they prescribe how people should deliver care to patients with brain tumours. You have very detailed guidelines for some aspects, but when it comes to rehabilitation, there is only one sentence.
Right, yeah.
What is needed to get those guidelines? You need people to do high quality research. So we are training those physios and occupational therapists to be able to do that research, to then inform those guidelines. And we believe that when those guidelines are there will be less variation. And we're in the mission all about reducing that variation so that whether you get your diagnosis in London or rural Scotland or in the peninsula, you get the same high quality care.
Brilliant. No, because as a patient, you learn to build that. You're into a community, and I. It shocks me sometimes when I hear of the service and the care being provided in some of, like you say, some of the more rural locations where they just don't have access to the same things, and it's like that's not fair.
It's not fair, exactly.
As a patient, I feel frustrated that I'm telling one of my brain tumour friends that, I did this and this was provided, and they're like, oh, I didn't even know that was something that could be done, or my nurse never said that to me or gave me that opportunity. So I'm all for anything that helps that journey, because there is, like you said, the clinical research side, which plays such a crucial role, but holding someone's hand through this process is just as important.
Absolutely.
And I don't think people realise how much of a difference that makes going into your scan with a smile. And I know that's a weird thing to say, but being a bit positive about it rather than dreading it to its core, it does have an effect on your day-to-day.
Absolutely. And we think a lot about, we think about the patients, but we also think about the staff looking at the patients. And what we see is that many professionals are really going above and beyond. So they'll be paid for, an 8 or 12-hour shift. But you'll see those same nurses or allied health professionals, they, for example, find out that someone has lost their job and they qualify for benefits. But not everyone might know how to apply for that. So I've heard of people who then will help you fill out the paperwork, and nurses will do that in their own time to request that. And that's great. But we therefore really advocate that those nurse teams and allied health professionals are adequately staffed, so that you don't have to do this 14 or 16 hours a day. But, I would say a good workforce or a happy workforce, happy patients. So we very much start by empowering the professionals and that will have a really positive effect on patients, we believe.
I think what you just said there about being able to fill forms out, I think it's the stuff that people miss, because when you're on treatment and you're doing a load of there are a whole load of other worries that are kind of come with that part of it. Yeah. But actually getting someone to take the form out, and that's the difficult bit. For me, it's kind of like, okay, which form was it again? Yeah. Come back to another time. When actually being able to kind of have someone support you during that process is, I find anyway, is just as important.
Absolutely.
In your journey, because it really does change the way you approach certain things, I think. And you don't seclude yourself as well. I feel that is another part of the whole journey that people don't understand quite as much as well, because when you don't understand it, you don't know it, you don't understand that it's even there or exists, you tend to just kind of seclude yourself and shy away from it. Just get on with your treatment and move on to the next thing.
And that's what I see. You know, people report, there's a nursing staffing shortage, or there's a shortage in healthcare assistants. And you can look at it that way, but what we know from our relationships with the centres and the data we collect, that means people not getting their financial support filled out, people not being referred to community therapy, or that you go to a more passive way of giving care. So if someone gets a new symptom and you ring up, sure, they will help you, but actually best practice is that you are proactive. So you are going to ask patients, by the way, that your vision changed, and you might forget when you're stressed to mention that. So we really promote that proactive monitoring of patients, but you can only do that when you're well staffed and when you have the time to deliver that, and you have time to offer those assessments. And we see that more and more. So I find it very encouraging just how much kind of the people who help you with your symptom management, how much even better organized they've gotten, and the leadership training they're going through, and the networking they're doing, and yes, fantastic to see. So one of the things, for example, we do, and it costs no money, but we host what we call show and tells, where different rehabilitation teams take turns presenting every week what their service is like, and they say this is going really well and this we're still working on, and then people from other centres can comment, and off the back of that people have done site visits, submitted new business cases, and some people were like, oh my god, I can't believe you're putting this on for patients, and just, you know, there's this saying of you can't be what you can't see, and just by spreading the excellence, and we see sometimes excellence being trapped in a single hospital, and a hospital might not know that they're the best at something, and a simple cheap thing you can do is making that available, and it has very powerful effects on both the workforce and then the knock-on effects on patients who feel supported.
What you just said, I think there's like, the word that springs to my mind is collaboration. Collaborating between all these different staff who've got all different sets of skills, and you don't even know sometimes the hidden talent that is there to unlock. How many centres would you say, how many centres kind of are up to scratch on this? How much more work do we have to do?
At the moment, there are about 30 centres that give comprehensive brain tumour care. For adults, 14 of those are excellent, but we've just received another 7 centres. They're still going through the assessment. What I've seen is incredibly encouraging, and I hope that in the next few months, at least 2/3 of all the centres provide what we call Tessa Jowell standard of excellent care. So where I really feel you can go through the door and be like, you know, I'll get the best I can. That's not to say that the centres who are not excellent at the moment don't offer that as well. Actually, in some of those centres that don't have the status yet, the nurse and AHP-led care and the rehab care is actually fantastic. So we want to work on making that known to patients. So it might just have to do something with a waiting time elsewhere, or maybe access to trials. But what really a message what I would want to give to patients is just the encouragement I get every day from just how special the workforce are. They go above and beyond, and staff, you know, it's not an easy climate in the NHS at the moment, but if you see the mountains they move behind the scenes to show up every day for patients and to give that, I find that extraordinarily special, and it is certainly something that gets me out of bed, that I think, we have to keep building on this. And becoming a Tessa Jowell Centre of Excellence, it doesn't come with money. You get a plaque, and it takes a lot of time, and it's a lot of hard work to meet all these standards, but the staff care, and they say we buy in this vision of equity of access. And they do that. On top of their day jobs, they'll make those changes to show up for the patients. And I think that is something that I hope patients will be able to take in and be like, okay, they do really care about me.
Being a patient, yes. yes, and yes. Like, knowing that someone does care and support me is like half my battle in that appointment, in that hospital, in whatever it is that I'm going through. I can't touch the clinical side of what's happening, but if someone give me a hug, or Sam, do you want a cup of tea, or can I get you a glass of water, just knowing my name. I can't explain to you how big a difference that makes. When I go into the hospital, now that I've finished my radiotherapy and chemo, the fact that people remember me, how are you doing, how are your daughters, give a high five to someone that comes through, it really does change my day. And even during treatment, I know part of the mission is to be able to, it's the full process from start to finish. And during my treatment, it would be like coming in, high fives, and you don't feel like you're going in for a radiotherapy session, and it really does change your day as a patient, because something that was really intimidating at the start of the day and something which you didn't want to do, all of a sudden becomes, okay, actually I'm going to go and meet a few people I like and have a conversation with someone I like and get this bit done and get out of there, because that is the reality of it. And I can't it's so important. It's crucial, vital.
No, and look, it's so interesting to hear your other side of that, because as I told you before, I think sometimes people will say, well, why don't you double down on the new research and trying to get new treatments out there to cure people? And we do that too. But I cannot forget about all the patients out there today. So the latest course that we're rolling out is actually one for healthcare assistants.
Right, okay.
And those are the people, when you wake up from surgery, they will wash you. And they will be the first one to try and get you upright and get you to take a walk. And actually their contact time with patients is massive. And those people have had limited training. And they say, look, they've told me patients with a brain tumor are among some of the most complex patients we look after. We want to be upskilled in how to do that. So we're offering a training course for them. And I think it's really encouraging that they say, I want to know more, I want to do better. And many people have signed up to this course. And as part of this course, we want to do career development. So a lot of healthcare assistants might later study to become a nurse or to become an allied health professional. And we want those people to see, look, in brain tumors things are happening right now, new innovation coming through, a real focus on quality of life. So if I specialize into this group of patients, it's going to be exciting for the next 10, 20, 30 years, and it will be rewarding, and I'll see that change coming through. And I think we're one of the only organizations who do also focus on the healthcare assistants. And for us, it's for everyone. Everyone who wants to make things better for people with a brain tumor. I want there to be a home at the mission, and I think there is a home and a community.
You're absolutely right. Like, as brain tumor patients, we are split up into communities as well. You've got people who have just been diagnosed. You've got the people that are to be diagnosed as well, and the people that have kind of passed on from it. And research is going to be the ultimate, fundamental thing that gets us out of this. But there's me. And there's a whole load of other people that are already in this at this moment in time. And the kind of way we are looked after is so important to how we live our lives on a day-to-day basis. And how we do that affects so many other people. Being a husband and a father, that kind of way I come out of hospital really feeds into their days and their lives. And if I'm coming out of there feeling positive and feeling re-energized to a certain degree, however difficult the situation is, that makes a huge difference to a lot of people's lives, not just me as an individual. That's affecting a whole community or a whole family as such. And I'm so glad that you said it in that way, because that is equally important. You know, the community that is going through this now, that maybe we won't see a cure for this as such in our lifetime and in our generation. What can we get? We can get a bit of support. We can get a bit of love. We can get a bit of kindness.
Yeah, absolutely. Couldn't have said it better myself.
Okay, Nicky. So as we know, things are slow progressing at the moment within the brain tumour sphere. It's not an easy thing to look at, and I completely appreciate that. What are the mission doing at the moment? What is the kind of latest updates and kind of where are we moving to? Where are we progressing? What is happening basically?
Yeah, so we do 3 things. We improve care for patients today with a brain tumour with a focus on making care as equitable between all the centres in the UK. Then a second element is training the workforce. So we offer training courses for further specialisation. And then the third element that we do is we accelerate new research and try and get new trials to the UK so that patients can try something new. And hopefully we get new treatments coming through, because at the moment for adults and children there's very little and it's not good enough. So I think that work is extremely interesting. So at the mission we run what is called a brain tumour research novel therapeutics accelerator. It's a very, very big term. But essentially what it is, it's a place for anyone who's developing a new treatment to come to us, and there is a board of 15 different experts, all the way from regulation, toxicology, bioavailability, trial design, animal models, anything you can think of, they will be there.
Right.
And they come for free. And then you fly in, and for a whole day, you'll have these experts thinking along and think, okay, what can we do to support these patients?
Right,
okay. Or to really, what can we do to bring this treatment to the clinic?
Okay.
And the life cycle of that is very long. So...
That's the thing I was going to say. It can be a very, very long process from having that first kind of bit of research saying, oh, this could be something, to here's medication that I can give a patient. Yeah.
And you start often, as you said, in a lab. And you'll do an experiment and you show positive results. So you show that an agent might slow down tumour cells in a lab dish. Then what you need to do is you need to prove that often in 5 or 6 different models, different ways. You need an independent lab to verify it. And then at some point, as an academic, you then need to spin out. Because by the time you receive it in a package of pills, it's, part of often quite a large pharmaceutical company. So you have to commercialize on the way. That's where it sometimes gets a bit challenging, because, the most Darwinian... The group of companies out there, I think, are those small biotechs. So suddenly, first you are in an academic institution and you can get charitable funding. And then when you become a company, often there is no access anymore to sometimes to charitable funds. Not always, but it is much harder to get that.
I smile right now because it's kind of, if I didn't smile, I'd cry, because of how frustrating that is, that accessibility for us as patients for treatment, basically. Something other than chemo and radio that we would have been given for the last 30, 35 years.
But they exist, and they are, they're trying very hard, and they are very nimble and creative. And what we see now is there are more venture capital firms actually investing into these companies. And if I look at the alumni from the Missions Accelerator, there are 2 this year who've received funding, actually commercial funding, to start their treatment in clinical trials in the UK.
To actually start the clinical trials.
Exactly, and that is in the last 3 years alone, and I expect more alums to join. So actually that is possible, and I think one of the things that needs to change is sometimes more imaginative funding for those biotechs. Of course, there are large pharmaceutical companies who will also have their portfolios, but I think it is those spin-outs that really sometimes need that support to get there. But I'm very encouraged in a way by what I see. But that would be really a call to action for me, is support those startups. They often have a runway, or they have 6 or 12 months left. They need to show more experiments quickly, apply for new funding again. But they are some of the most remarkable people again I've met.
You're singing off the same hymn sheet as me, because they are some amazing people with an incredible passion and a drive. Yeah. I don't understand half of what they're saying to me when they talk about all the DNA and the genomics of it. Yeah. But they are so convinced that the work has been done here somewhere. Yeah. You just need to give us an opportunity to open that up a little bit more. And like you said, being able to look for more innovative ways of funding, because you can keep knocking on one door as much as possible. Yeah. But if they're not answering, you've got to kind of try different things. Exactly. And that's the hope that we all kind of live in every day, right? Yeah. And I'm glad that you kind of have been able to acknowledge that, because it is kind of frustrating from our side when you kind of want to knock that door down so badly and let some people through it, but you're just not given that opportunity as such. And I'm glad it's recognised.
Yeah, and I think that there is progress in these small companies coming through. And what is so remarkable when I look at the accelerator program is that these world-class experts, and normally when you're a company, you need to pay thousands and thousands of pounds. And we run the calculations to run a meeting like that for one company usually costs about £250,000 in terms of the fees you have to pay these experts. And all the experts said, because brain tumours are so behind, will waive our fees and come do that for free. So it's a beautiful example of people from across the world, exactly, and coming from commercial backgrounds as well as non-profit and universities to come do that. So these are just some of the pockets that I see and think, wow, I'm really excited about that. And it's a place that scientists can go to, not to get backwards advice and say, okay, you are or aren't good enough for this grant. It is all 15 people thinking, what do you need to do next in the next 2 years? And what do we think you should do to give this the best possible chance? And that forward-thinking advice is something I'm really excited about. And seeing those alumni get more funding and thrive is really important. So that for me is one element. So thinking, are we in the UK and across the world good enough at fostering those innovative companies or helping these academics spin out? And then the other thing that we need to look at is, are we ready in the hospitals to open trials? Yeah. So if those companies have the money and they come with, a nice amount of funding, can we open those trials? And the answer is it depends. So some hospitals are better at that than others. Yeah. Coming back to that equity point, I really feel that no matter where you're diagnosed, people should they should test your tumour and think, can this person be offered an opportunity? And I accept that not every smaller regional hospital can run really complex phase 1 trials where the risk is high. But can we at least screen? And can we then offer patients travel support or some support to travel to those centres that we can? And that again, screening and referring people is a much lower cost intervention than saying, hold on, everyone needs to be ready to deliver these huge trials, because that is just not
It's not going to be possible, It's innovative thinking, creative thinking. Yeah. But like you said, fair thinking right across the board.
Exactly. So we really push for that screening. And we want patients to feel empowered to ask, have I been screened for trials? Did I get whole genome sequencing to test this?
I think a lot of people don't even realise.
Yeah, because the reason why is it's so early in your journey. So compared to other cancers, you only have 1 or 2 shots to ever go into someone's brain. And with a brain tumour, if you've got the most common one, the one that Baroness Jowell had, you often get offered surgery within 1-2 weeks. That's not enough time for you to start educating yourself and reading. It's such a roller coaster.
Right. You're
so that's not up to the patient to feel empowered. That's maybe something if you want to 6 months later down the line, once you've.
It is a common. I mean, I've spoken to so many other brain tumour patients where that's not going through my mind on those first few weeks.
No.
How the hell am I going to live? It's kind of what's going through my mind in those first few weeks.
If you have a cancer that you can easily biopsy, that's not a problem. You can do that later. But the brain is in your head. So you only have very limited opportunities to test. So you have to get that tissue at the time of the surgery. And that's something that we are really pushing for. And we're getting better at as a country. So the people who have that tissue frozen is going up and up. We see that in the data. The people who get advanced genetic testing is going up. And the number of trials that are now open that require this testing to get very personalized treatment are increasing as well. And the beauty of that is there's now a bit of a virtuous cycle because there are these trials. Centers are like, okay, because it's really difficult to set it up locally. But we see that willingness, again, coming back to the local champions for people to stand up for that. And I've heard great stories of surgeons trying to get everyone in the operating theatre. And I've seen people and they said, I've made a PowerPoint and I've stuck it on the wall so that no matter who is doing the surgery, here are the steps. This is who you need to ring to roll the fresh frozen tissue to. This is the van person who comes and pick it up, and it's all there. And people are organizing the logistics because it's not just the surgeon. It is someone picking up your tissue. So you need, a porter to come get it, get the right storage device, walk it across the street, get it into the right van.
Let's get this out everywhere.
Yeah, and it's happening. It's happening. So I would like to see it happen faster, but again, the upwards trajectory is there, and I'm really excited for that, so that patients do not have to think one week after their diagnosis to think, will my surgeon do the right thing? And that's coming back to my point. My vision for the near-term future is you walk through the door of your center and you're like, everything will be taken care of.
I love that. You've come back to that so many times.
Yeah.
That's all we really want. Yeah. We've already been dealt a hard hand.
Yeah.
Okay, let's just be able to be calm through that. Yeah. And be.
Yeah, and that's what I hope that people see when you've got the Tessa Jowell Centre of Excellence plaque on the wall. You want people to be.
I want to see that.
Yeah, and I certainly feel that. Yeah. When I see the staff talk and how much thought has gone into these different elements of care, and it's a very, very intricate way that is all glued together, and that's the aim, that you have the seamless care from surgery to waking up and getting your post-operative, getting the assessments, getting a good plan when you go home, and then every time, as you said, when you come back to the hospital, you're being treated like a human. They check for any new symptoms, and then
I get treated like a king. Exactly. So I want that. It really does make a huge difference.
And whether that is someone who's really well informed and reads everything that is to read, and someone who's vocal and passionate, or someone who has a partner who is a passionate advocate for them. It shouldn't matter if you are like that, or if you're older and you're maybe alone or quieter or more shy, or you cannot express yourself, or there are language barriers. There can be so many reasons, and speech can be affected with patients with a brain tumour. So if that's the case, that shouldn't be something that stops you from being picked up on new symptoms. And that is the bit, that kind of care you get when everything falls into place.
Bridging those gaps.
And I've seen beautiful examples of that, and that's what we will keep pushing for day in, day out as we show up.
Nicky, could you give me more of an idea of the structure of the mission?
Yes, so we're set up in a very unique way. So we are what's called a convening body. So we exist of 12 different charitable organizations. Okay. The government as well, through the National Institute for Health Research. We've got support from pharmaceutical companies, and then we've got relationships with every single NHS hospital throughout the UK. Wow, so we are a convening body of professionals, charity sector, healthcare professionals, as well as patients and patient advocates.
Right.
And we all come together behind this idea of providing equitable care for patients.
Right.
So we're not replacing what's going on, but we are unique in a way that we can run projects that one single organization couldn't do. Right. So the fact, for example, that we collect data from every single hospital in the UK, the NHS isn't, we don't do that as the NHS, we don't do that as a single charity, we do that as a collective. And we've been given that permission to do that. Right. And then we make the data available to all the charities that we work with. So every charity that is part of the mission does their own amazing things. They fund many millions into research. We know that the charities collectively have spent £100 million on research in the last few years alone. They have their own fantastic patients helplines, coaching. But within the mission, they come together on let's reduce variation. Right. Let's improve equity, and let's as a group see what can we do as a singular voice to try and get more trials open in the UK to work together more closely with government.
Many voices come together as one singular voice. Okay.
Exactly. And what is really nice on every single project, depending on what it is, we work with different partners who are really strong in that area to get the best possible results. Okay. So when we talk to centres about the care that we deliver, we work together with our partner charity, the Brain Tumour Charity, and they will ask their patients to give patient feedback. So every centre will have 50, 100 independent bits of patient feedback that we can then compare with what does the hospital says it deliver and what do the patients say they deliver. And that is, that's a unique way of having the full picture. Yeah. And similarly, when we work on the Brain Tumour Research Therapeutics Accelerator, that's sponsored, and we partner with the charity called Brain Tumour Research. They sponsor this program. They've got a strong background in research. Yeah. So again, they know many fantastic scientists, so that collaborating is really unique. And the same with, say, SIA UK. We can work with our policy team sometimes on important initiatives. So we're very lucky that we can benefit from the most powerful organizations in the country to do the best for patients with a brain tumour.
Two words, collaborate comes to mind, collective. Those two kind of, because I think a lot of people, including myself, I guess, would just assume that this mission is just one charity or one group of people doing it, but actually to understand that it is made up of all these different kind of elements of specialism as well. Not everyone is exactly the same into it. That diversity is so much more encouraging for someone like me to hear, because I know how much movement people have made in other areas, and it's kind of like I really want that for me in my community now, and let's learn off of each other. Because it isn't a secret, hidden thing how to get through this thing. This is kind of like, let's share this information and this knowledge.
But having said that, the Tessa Jowell Foundation, which is the charity founded by Jess and her mother Tessa, they are the one organization that exist to support the brain cancer mission. So for us, they've been a core funder. And actually, as we've had many new ideas of what we could do next, based on the data that we got, the foundation has been a fantastic supporter of us to say, we believe in this idea, let's fund the pilot. And then if the pilot gets successful, we can then open it up to the other charities and say, it's a successful program, would you like to fund that? So for us, the foundation has been so pivotal in building us as an organization. So 8 years ago, it was just me as only employee, and now we've got a team of 10, and we've got over 150 nurses, doctors, and patient representatives who really design and deliver the programs. But that has been made possible over the years by the Tessa Jowell Foundation funding that. So they were the first to fund our children's programs, and then fantastic other organizations funded. They were the first one to support our training and fellowship program, and now others have followed. So having that organization that says, we believe in you and we believe in the mission, and the others all do, they're fantastic, but really the foundation has been the catalyst for growth and who we are today.
You need a starting point, right?
Yeah, and you need a strong believer.
Exactly, and then once you have that,
Yeah.
Just fly.
Yeah, and they give us the name. So we,
yeah.
of course, can only carry the name Tessa if the quality what we do is very high. So it's really a privilege for us to be given the name Tessa Jowell. And I think often about what she stood for. And I think, would this initiative pass her test? And does it meet her vision of it has to be accessible for all?
Yeah.
And sometimes channeling a bit of Tessa in the meeting. And I was in a meeting with
a bad thing.
exactly with Jess the other day, and she told other people, is this really the best you can do for patients with a brain tumor? And people were like,
challenging people. Yeah.
Exactly. And they listened to her and they stepped up. So that's what's so special when you can, as an organization, deliver on someone's legacy. Is you try that so hard, and I see that as a strength. And she was very much for all patients. So it isn't just we do this for Tessa, but we try and do it with her criteria and vision.
That's the fire, right? That's the starting point, the spark, and then let it light up.
Exactly.
Nicky, I just wanted to say thank you for your time and thank you for explaining that through to me, because I thought I knew a lot about what was going on, and actually you being able to lay that out is actually really, really helpful and useful to knowing what it is exactly the mission are doing, what its purpose, what its drive is, and kind of where the foundation supports that, and how many other people are involved in this whole thing. I mean, it's more exciting for someone like myself to hear how many different areas are kind of coming into this to form this mission. So thank you for your time. Thank you for taking the time to actually explain everything in such great detail.
Thank you. Thank you.